Okay, I will introduce my team now. Uh, this is my team. Uh, we will introduce ourselves. So, my name is Nam. Her name is Lộc. Uh, her name is Han. Her name is Her. Her name is Lân. Her name is Phương. And her name is Hào. Okay, and his name is Hey. Okay, we will introduce to you about insomnia. Yes. First, I have a question. Are you sleeping? Are you sleeping? Okay. And do you know what does insomnia mean? So you can sleep now. First, we will discuss about what causes insomnia. Insomnia have many reasons. First is food. Why food causes insomnia? Any idea? Food causes insomnia because if we eat food before we sleep, our body will have to digest this food so that it cannot relax, and so we will feel difficult to sleep. The same with exercise and the street have light, noise, and temperature, everything can cause insomnia. So, and the coffee too. But it's not what we discussed about. Here is what we discussed about. The problem is psychological causes, medication, medical problems, and something important is Gideon and Harry. With Gideon and Harry, this is called sleeping in the class. Next, my friend will introduce to you about symptoms. Mr. Lee, please.
Okay, thank you for having me. And now I'm going to talk about some symptoms for you to understand more deeply about insomnia. So there are several symptoms of insomnia. Insomnia is both a disorder and a symptom of other sleep, mental, and psychiatric disorders. If you are suffering from insomnia, you find it difficult to fall asleep and feel awakened several times, wakened too early, or very short sleeping time, and feel difficult to return to sleep once interrupted. So, moreover, the symptoms can lead to more daytime problems such as irritability, tiredness, and drowsiness. Lack of sleep causes your brain to slow and shut down completely. In other words, insomnia absolutely can lead to poor concentration and shorten your attention span. So, if the chronic insomnia continuously lasts, it perhaps causes more severe complications. So there are some complications of insomnia. So the first is psychological problems, such as low performance, slow reaction time, risk of depression, and risk of anxiety disorder. Secondly, your immune system functions is also affected. So the next issue is that you will be overweight or obesity and high blood pressure. So what's more, you probably get the higher risk of heart disease and risk of diabetes. So do you know how many types of insomnia has? Do you have any ideas? Okay, so now I'm going to talk about a little bit more about it. The answer is two. So insomnia can be classified into two types. There's primary insomnia and secondary insomnia. The first is primary insomnia. Is divided by someone who is having sleep problems, which are not a result of medical conditions or disorder. And the second is secondary insomnia, is divided by someone who is having sleep problems as a result of medical conditions or illness, chronic pain, patient effects, or substance abuse, or problems such as alcohol or drug abuse. So, okay. The other issue the other important issue that really counts, and I don't really want to miss the time, is about I want you to understand more clearly about insomnia. So we go to in details. The first is primary insomnia. Many patients with chronic insomnia has no clear, single, identifiable underlying process for their difficulties with sleep. Such patients have multiple etiologies for their insomnia. As you know, anxiety and mood complaints, psychophysiology problems, poor sleep hygiene may be causes and consequences of chronic insomnia. And treatment of insomnia is often directed to each of potential contributing factors. For example, behavioral therapies for anxiety and negative conditions, pharmacotherapy or psychotherapy for mood anxiety disorders. You know, alcohols and antihistamines are the most commonly used non-prescription sleep aids. The patients, at first, these medicines seem to be helpful, but after that, it can escalate into drug abuse and make you dependent on these medicines. Therefore, I am sure you will wonder that what drugs are considered for taking safely for the treatment of insomnia. So, the pencil diazepam receptor agonists are the most effective and well-tolerated class of medications for insomnia. As a matter of fact, the half-life of benzodiazepine allows flexibility in the duration of sedative action. So the box below will show you some most commonly prescribed agents in this medications family. Okay, you can see the xylitol, the half-life of xylitol from 5 to 20 milligrams lasts 1 to 2 hours only. And the Solviron and chimazolone is 2 to 3 hours. Escitalopram is 5.5 to 8 hours. Lorazepam and simvastatin is 6 to 12 hours. Okay. So the presentations will be continued with Mr. Nam.
Okay. Are you sleeping? Okay, I will introduce you about psychophysiology insomnia. So, the psychophysiology insomnia will occur with people who don't get enough sleep, deep sleep. Okay. Anybody get enough deep sleep? No. Okay, so it counts. Sleeping. The people who don't get enough deep sleep will feel very tired and sleepy in the day, in the next day. So we have some treatment. We have some treatment. The treatment very simple. Is get a good schedule. Time, sleep wake schedule. Because if you have good schedule, we can control the time to sleep, the time to wake, and so we don't we won't be in daytime sleepiness. Okay. And the other is relax. Relax is one way to solve this problem because if we feel sleepy, we can listen to music, do some exercise or something. But do not allow your body to sleep because if you allow your body to sleep, your body will change the circadian rhythm, and then you will very hard to change this again. And then the neurologic disorders. The neurologic disorders, we don't have to care about this very much because it just occurs with people who have neurologic disease. So the symptoms is associated with neurologic disease. And the treatment is very simple. It's sleep. Because follow today research, the sleep can greatly reduce the disease, the neurologic disease. So if the patient have neurologic disease, they should have good time, good sleep schedule. Okay. And next is the heat.
Okay, continue. We will have the medical disorders. There is a number of medical conditions associated with disruptions of sleep. So some illustrations for this are hypothyroidism, chronic renal failure, acid reflux, asthma, cancer or carcinoma, and even chronic pain. So the next disease I would like to introduce to you is the restless leg syndrome, RLS. Patients with this sensory motor disorder report an irresistible urge to move the legs. And the leg restlessness is much more worse in the evening than the daytime, and especially at night. And this symptom is will wax and wane over time. And the prevalence of is 10 to 20% of those who older than 60. Iron deficiency, renal value, and polyuria may also cause RLS. So, in addition to that, the treatment is we can use pegful, ropeginol, opiates, and benzodiazepine receptor agonists will also considered to be good choices.
Okay. Next is sleepwalk disorder. What is sleepwalk disorder? Because there are so many people who have to work from 1 a.m. to 7 a.m. and then so they work at the night when we sleep, so they have some trouble. This disorder can cause some serious danger. First, they cause cancer because they cause cancer like breast cancer. They cause disorders like cancer, and if we work in a condition that we don't have enough consciousness, fatal work accident can occur anytime. Okay. And the treatment, coffee and caffeine is a good treatment to keep consciousness, but it's not solve anything. Just about consciousness and fatal work accident, but the cancer and disorders is not. And next is do some exercise or change the position, because this will help you to refresh your body, so it can reduce some danger of cancer or disorder. And last is get a good time schedule. Okay, what is good time schedule for this patient? Good time schedule is you have a nap, a short sleep. Yeah.
Okay. In conclusion, I will give you some advices for this presentation. Okay. Firstly, to patients, if you unfortunately have insomnia or you believe you have sleep disorder, please go to see the doctors at once. And do not take any neuroleptics by yourself without doctor's diagnosis and treatment. And for the doctors, please we avoid to prescribe medicines for the patients. These medicines below: amitriptyline, antihistamines, and diazepam, psilocin. Because these medicines will aggravate the problems. To make it simply, I mean, it will make sure sleep disorder become much worse. Okay, and you should prescribe from low to high dose. For example, we can give some medicines for the patients at first is heart medicines, such as here is an example: protein D, mimosa, valerian, olizapine, and benzodiazepine. So that's all my presentations. Thank you for your attention. Thank you. Thank you for having me.